So Ben, firstly, please can you tell us about how the cancer diagnosis pathway has been affected in light of COVID-19?
What we have found during COVID is that patients have been frightened about attending hospital appointments, and we have worked very hard to try and work with them to reduce the risk as much as we can to potentially coming into contact with COVID-19 whilst in the hospital. We can never say that there is no risk, but we have taken many steps to reduce that risk. We have continued to see patients and to diagnose cancer throughout the COVID-19 crisis. And it's important that we do that because we do not wish for our cancer patients to have delayed diagnosis or to have delayed treatment due to other issues going on within the hospital. Some of the steps we have taken are to try and do as much of our consultations as virtual as possible. So this may mean telephone calls, telephone consultations, and using web-based video platforms. This is a big change to how we would normally do things. And I know a lot of patients would prefer to come and see us and discuss things face to face. But really, if we can reduce patients traveling in and out of hospital and traveling into hospital, that does reduce the risk. So whilst we know that patients like talking to us face to face, and we will try and do that via web-based video if possible, telephone consultations we've found have been very fulfilling, very useful, and enabled us to explain to patients what's going on and to talk them through their symptoms and how we might manage them. Other steps that we have taken to reduce the risk is that we have different pathways within the hospital based on what's happening and what procedure you might be having and potential risk to COVID. So patients are all screened before they enter the hospital, and if they have any symptoms suggestive of COVID or have high temperature, then they are tested for COVID and go down a COVID pathway. If patients are not showing signs or symptoms, then they will be given advice on potentially isolating for a period of time before coming into the hospital. For surgery, we are asking patients and their whole household to isolate at home for 14 days prior to surgery, so that if anybody in that household does have COVID, it will the symptoms should have developed by then. We're also testing patients for COVID with a swab 48 to 72 hours before any surgical procedure. If all these criteria are fulfilled, then we can admit them to a special ward within the hospital and use special dedicated theatre space within the hospital where patients are going through similar pre-operative workup as themselves, i.e. the shielding at home, the isolating at home, and the tests at home, to mean that they're in as lower risk area as possible. As I said, we cannot make it completely risk-free, but it's as low risk as possible.